Hello, I'm Trichologist Carolyn at Absolique Hair Health Clinic. Today I want to talk about menopause health and how that can relate to the perimenopause hair loss as well. So, as soon as you start to enter that perimenopause or menopause stage, there's a particular pattern of hair thinning that is related to sort of recessions, front, top. And they just say it's just menopause and age, and that's all it is. But what I find is people's hair cycles are really broken down by that time, and it's an accumulation of life events, particularly for women. In this case, we share she'd had surgeries, anaesthetic, medications, postpartum, post-pregnancy, and she'd had a long history of low iron. So, like, had these things been looked at and checked before she entered into this perimenopause stage, things would have been much better. So we went in and we found that she actually had loose anagen syndrome, meaning her hair bulbs had no structure. Her hair cycle and hair cell, 95% of it was already broken down, prior to this. So it was from past telogen effluvium, diffuse hair loss, diffuse hair thinning. And what this was exposing was the menopausal type recession areas that we showed there. So if you want to prevent this perimenopause hair loss and even just the menopausal symptoms, you can start with a health check. And I'd be starting for women in your 40s at least. So get your health checked. Always looking at iron studies, B12, vitamin D, cholesterol actually tells a very interesting thing about essential fatty acids, the chemistry, and particularly thyroid function as well. So if you do this regularly, meaning at least once a year, we're not just looking at what's in range, we're looking at where things are moving for you. So it needs to be a little bit more individual. And it's what we call baseline testing, and it really helps us to see not just are you in range, but are you sufficient? And that's where a functional practitioner will say, well, okay, ferritin lower level is 30, you're 31, you're fine. Whereas for hair and health, we need it to be 70 to 100. So we've got specific markers that we look for B12 and also vitamin D. So it's not just for the sake of hair, skin, and nails, but we're actually looking for overall well-being and really floating through menopause without any problems. The other thing we also do is microscopic diagnosis. So this is what tells us when the hair cell or the hair cycle is broken down. It tells us if there is any pattern hair thinning there. Most of the time I do find it is there, but we can treat it in a different way and we go more holistic, so we don't have to use harmful medications that you've got to be on forever that cause lots of these side effects that people don't like. And once I've got all that information, I can give a clear direction based on your blood tests and your microscopic diagnosis. And most of the treatments that we can choose are actually really quite simple and affordable and are very, very health-based. So if you're experiencing any hair loss or hair thinning around menopause and you're told it's just age or it's just the way that it is, it's not. Trust me, we can help. I'm based here in Brisbane, but we can help people anywhere in the world. You can see there on the screen our web, which has got all our socials and also my email address. So yeah, please reach out to me if you feel like you need my help. Thank you. Thanks for listening.